Doc, please, what is this result? Is it okay or should I buy medication? This is actually a result of a Widal test that was done by an individual, and the person was asking whether she should buy drug because of this positive test. I want us to understand that having a positive Widal test is not enough reason why you should start yourself on any antibiotics. I want you to please watch this video to the end so that you can understand the best time and other things that you will have in your body that will determine whether you should get medication, antibiotics or not, whether you should buy a drug or not. Don't just start yourself on antibiotics. What I have noticed is that most people, whenever they have any fever, any headache, or any malaria, any symptom of malaria, they must do MP, that's a malaria parasite, and they are also going to do Widal test. And in most occasions, Widal test will come out positive. And then because of that positive Widal test, they will commence themselves on antibiotics. And this has resulted in most people having what is called resistance to antibiotics. Please watch this video. In case you are meeting me for the very first time, my name is Dr. Chidebere Ezra. This is where I teach about health issues. You can also follow me on every platform of social media. We are also on Facebook, on TikTok. Please, at this point in time, kindly subscribe and also turn on your notification. If you like what we are doing, help me to share this video so that it can get to many people as much as possible, so that we can help people in their health issues. Now, what I want you to understand about Widal test is that there are a lot of factors that can make a Widal test to be positive. For instance, if you are living in Africa, in sub-Saharan Africa, for example, in Nigeria, in Ghana, as far as you are living in this area, these areas, they are endemic for malaria. So the endemicity of malaria can cause this test to be positive in any individual. Even myself, if I should do this test now, with that test, it may also come out positive. So most people are going to come down with a positive Widal test. So it is not enough reason why you should take antibiotics. Another thing is that if you have upper respiratory tract infection, or you have been treated before for typhoid, that means that you have had the infection of typhoid fever, that is Malaria typhi, in your system, and you have been treated before, then the antibodies are still within your system. So that can also cause the result to be positive. But if you actually want to know whether you have Malaria typhi, there are specific tests that should be done. What I'm trying to tell you in essence is that Widal test is not specific for Malaria typhi. There are tests that are specific for it. For instance, blood culture. If you are having any symptoms that are suggestive of enteric fever, that is typhoid fever, then you have to do what is called blood culture. If you have done blood culture, then in that blood culture, the organism will be isolated. So the organism will grow. Then you can actually say that you have it or not, whether you have that organism or not. Or you do what is called bone marrow culture. Bone marrow culture is actually the gold standard. The gold standard test that should be done for people that you are suspecting whether they have enteric fever, that is Malaria typhi, or not. You understand? But if you cannot do these two tests, then you are going to have some of the features that I'm going to mention now. If you don't have any of these features, then you should not be thinking whether you have typhoid fever in your system, because Widal test is not enough. Number one is fever. The fever in typhoid fever is called step ladder fever, meaning that this fever will start and will continue going up. It does not go down. And in most occasions, that person may die in the course of that. You may also have what is called headache. So if you don't have fever, you don't have headache, and then there is no reason of you thinking of whether you have a typhoid fever or not, then you may also have what is called diarrhea, that is frequent watery stool. If you're having frequent watery stool or abdominal pain, I have mentioned 4 symptoms, that is 4 clinical features. Number 1 is fever, number 2 is headache, number 3 is abdominal pain, number 4 is diarrhea, number 5 is vomiting. You are now vomiting seriously, or you are having what is called myalgia, that is body pain, muscular pain, or you are so weak, that is general body weakness, that is malaise. You are feeling like you are not healthy, you are not okay as a result of the infection that is in your body. due to Salmonella typhi, or you are having what is called sweating, you are sweating so much, you are having sweating and you're also having chills, that is cold. These are the symptoms of typhoid fever, that is enteric fever. So if you don't have these symptoms and you have not done culture to confirm whether you have enteric fever or not, then there is no need of commencing yourself on antibiotics, so that you stop abusing antibiotics, because abuse of antibiotics can cause resistance to antibiotics, and that may cause you a problem in the future. Please don't forget to help me to share this video so that people will learn from what I have taught at this point in time. Thank you so much.